Hi everyone, Jesse Kingsbury here. Another video on how to self-manage and self-treat yourself when you've got a bit of an issue. So this time we're focusing on ITB friction syndrome. So this comes about through some tightness through your ITB, commonly seen in runners. And they increase their workload too quickly, or possibly some biomechanical fault going on. So previously, we used to see a lot of people foam rolling out their ITBs. So we now know that there isn't much happening when we actually roll out our ITBs. So the ITB itself it's not a muscle, it's just connective tissue, so it doesn't contract. We can't put enough pressure on it ourselves to manually stretch it with manual therapy or just with foam rolling. So this means that there's other structures that are causing the tension. So those other structures are your tensor fasciae lata and your glute max. So both of these muscles converge at the top of your ITB to join into the ITB. So it makes sense that when these two structures have some tension or some dysfunction, then you can get some dysfunction with the ITB as well. So today we'll focus on some treatment of the glute max and of your TFL to see if it can help with the symptoms if you are experiencing any sort of lateral knee pain sort of 10 to 15 minutes into your running. So the first one is your TFL. So your TFL is the short muscle that goes from the front of your hip it converges around about at your hip joint there, your hip bone into the ITB. So that's kind of where you'll feel it. If it's tight, you'll be able to strum over it pretty nicely. So the first technique is to lie face down. So you need to lie face down and with a little bit of a twist. Best to use a spiky ball. You can use a foam roller if it's too sensitive, but I find a spiky ball hits it nice and good. So it's just placing the ball in the right spot, twisted a little bit to get on the side, and just finding that sweet spot. Just breathing nicely and deeply and letting your body sink in to the ball. So you don't need to roll around on the ball as such, roll up and down. Just find that nice tender spot. Just breathe and let your body sink into the ball, then move it slightly up to the next spot that's tender. So the next structure that you need to target is your glute max. So for this we use a foam roller. Best way to do this is to get into the figure 4 stretch position. So ankle on your opposite knee, and just give it a little bit of a twist there as well, and you can roll just ever so slowly along your glute max there. Get a little bit of glute med as well, but you're aiming for the glute max to try and loosen that off. You can do it this way as well, but I find the figure 4 position is a bit more intense. Cool. So once you've targeted those two structures with the foam roller and the trigger point ball, you can go on to test it out with a bit of a jog, a bit of a run, and see how that's helped see how that's helped your symptoms. So give it a go and let me know how you go with it in the comments.